have gone to the doctor and your doctor said, you know what, your weight is off, or you have been found to have high blood pressure, or have high blood sugar, or you have a strong family history of heart attack and stroke, or maybe you are complaining of symptoms that are concerning for cardiovascular disease, heart attack, stroke, chances are your doctor has ordered these tests. That's the lipid profile or cholesterol panel. Do you know what these words mean? And did you bother to ask your doctor? But unfortunately, most healthcare providers do not discuss them each in details unless you ask them. Okay, so when you view your cholesterol panel results, they are broken down, as I've said, into 5 different numbers that mean different things. Now let's start breaking down your total cholesterol composition. These big sticky pieces of cholesterol can partially block your vessels, causing cardiovascular disease, heart attack, or stroke. You may not see this blood value on your cholesterol panel. If you see it on your blood report or laboratory report, it is considered high if it is greater than 30 milligrams per DL. So, how did you end up? You might say, okay, well, how did I end up with high cholesterol, and what can I do aside from taking medication? Hi, everybody. This is Dr. Delita again for another episode of my Sunday Drive. Welcome. If you're looking for a good dose of education and motivation to elevate your health, this is a place for you. And I am that person who can deliver you the correct information so you can make better changes in your health. So stick around. And I want you to get ready for our cholesterol roller coaster ride today. Let's dive into the wacky world of good and bad cholesterol or fats. We've been talking about this for the last couple of weeks, but it's nice to go inside and understand what these numbers mean so they are well taken care of, right? So now if you have gone to the doctor and your doctor said, you know what, your weight is off, or you have been found to have high blood pressure, or have high blood sugar, or you have a strong family history of heart attack and stroke, or maybe you are complaining of symptoms that are concerning for cardiovascular disease, heart attack, stroke, chances are your doctor has ordered these tests. That's the lipid profile or cholesterol panel. A lipid profile or cholesterol panel is a fasting blood test. And the test results would look like this. Now, I don't mean that your numbers look like this, numbers here. What I meant is that it's a single blood draw, but your result will come back with the breakdown of 5 categories. You have the cholesterol, or sometimes reported as total cholesterol, the triglyceride, HDL, LDL, and then the VLDL. Do you know what these words mean? And did you bother to ask your doctor? You must know, in my opinion, what these words and numbers, your numbers, mean, because they mean seriously in your health, increasing your risk for cardiovascular disease. But unfortunately, most healthcare providers do not discuss them each in details unless you ask them. But don't worry, you're going to brace yourself for a wild ride today, because we're going to go dive into this land of lipids and fats. And I promise to explain this as simply as possible, but also include the significance of these numbers and make sure you understand what those numbers mean in your report. Are you ready? Now let's dive in. Okay, so when you view your cholesterol panel results, they are broken down, as I've said, into 5 different numbers that mean different things. Sometimes it's just 4. There's no VLDL, and I'll explain later. Now let's start with cholesterol. This is sometimes reported as total cholesterol. You will notice on lab results that the total cholesterol is reported first. And this is because it reports the sum of all the different types of cholesterol in your bloodstream. Generally, the goal for total cholesterol is to keep it under 200 milligrams per DL. 200. Less than 200 is commonly reported as a normal lab value, and your healthcare provider probably tells you that you should be okay if it's less than 200. Now, 2 things about total cholesterol. First, just because your total cholesterol number is within the normal range, meaning less than 200, if that's what they set as normal, it does not mean that the other numbers, that the other cholesterol numbers in your report will be in the normal range as well. Remember, you can have a combination of low good cholesterol and high bad cholesterol. Often, the total cholesterol number is still within the normal range. Get the picture? The second thing about total cholesterol, you probably don't know this. What is considered normal, which is less than 200 per lab report, less than 200 of total cholesterol, that number appears not to be protective against cardiovascular disease. What studies have shown is that the total cholesterol level that is cardioprotective, blood vessel protective, is between, write this down, 90 to 140, not less than 200. Okay, so that's our total cholesterol. Now let's start breaking down your total cholesterol composition, starting with the LDL. The LDL, these are the larger cholesterol molecules responsible for plaques forming inside your arteries. Imagine big pieces of sticky gum or wax getting stuck in your blood vessels. These big sticky pieces of cholesterol can partially block your vessels, causing cardiovascular disease, heart attack, or stroke. They can also break open that plaque, that cholesterol plaque there can break open and cause blood clot to travel into the heart or to the brain, causing a heart attack or stroke. Now, when you have a high LDL or high bad cholesterol, you are at a greater risk for cardiovascular disease. It is generally advised to keep your LDL or bad cholesterol below 100. I want you to pay attention to this because you might not know this. Do you know that the physiologically normal LDL is not just less than 100, it's between 50 to 70 milligrams per DL. In his article, Introduction, More Than Coronary Artery Disease by Dr. Caldwell Esselstyn, he discussed how past cholesterol guidelines were not as strict as they needed to be, simply because advocating for an LDL between 50 to 70 milligrams per DL might frustrate the general public, and they may in turn not make any change at all. To learn more about LDL or bad cholesterol and its role in causing heart attack, and similarly the same process with ischemic stroke, I invite you to watch my video on heart attack. It's in my YouTube channel and website as well. Now, We're done with the total cholesterol, the LDL or bad cholesterol. Next stop is your HDL or high density lipoprotein. The good news is that some fats swirling in our bloodstream are good for us. This show up as in our blood as the good cholesterol molecules or HDL. H for happy. Easy to remember, right? H for happy, that's the good cholesterol. Do you know that high good cholesterol levels help your body cleanse the bad cholesterol via the liver? They're kind of like the sweepers, the cleaners. So these molecules, the HDL cholesterol, are smaller and not as sticky as the LDL. Your HDL, your high density lipoprotein cholesterol level, should be greater than 40 milligrams per DL. 40 milligrams per DL. Now, having a low good cholesterol puts you at risk for cardiovascular disease too. And conversely, if you get it as high as possible, high HDL, it is protective for cardiovascular disease. You can increase your good cholesterol by eating foods that contain unsaturated fats, the good fats, and you can also increase that by regular exercise. Now, not just exercise, take note of the word regular exercise. And if you want to ask, what does that mean? By the recommendation, a minimum of 150 minutes of moderate intensity exercise per week. Okay, what are the factors that can lower my good cholesterol? There are many. To mention a few, there's your smoking, being overweight or obese, and having a sedentary lifestyle. People with type 2 diabetes and high triglycerides tend also to have lower HDL. Those who are taking steroids or beta blocker for blood pressure control, those can also have lower HDL or lower good cholesterol levels. All right. Our next stop in the lipid profile is your triglycerides. This one. Now, triglycerides are also fats that are commonly floating in our blood, and they can indicate an excess of other things like sugar. So, if you have high blood sugar or you are diabetic already, you look at your triglyceride level. Chances are it's very likely high too. The triglyceride is also high, most likely, when your sugar is high. Imagine pairing a high triglyceride and a high bad cholesterol. This equates to atherosclerosis or hardening of your blood vessels or your arteries. Remember, atherosclerosis or hardening of the arteries can put you in a greater risk for heart attack, peripheral vascular disease, and stroke. Now we're down to our last item in the lipid profile, the VLDL. It means very low density lipoprotein. What is this? Very simple. What did we say about the LDL? The LDL? The LDL is what we refer to as our bad cholesterol. How is it easier to memorize these letters, this acronyms? Very simple. My style is this. For easy memorization, we can remember L as lethal. Okay? L stands for lethal, although that's not what the L stands for in the LDL. That's just for coding. L for lethal. That's the bad. So the VLDL can be our very lethal, right? Bad cholesterol. So like the LDL, High VLDL levels correlate with plaque formation, and in the arteries, it can also restrict or block blood flow. Here's the thing, you may not see this blood value on your cholesterol panel. I added that one here. Why? Not always not shown in our result? Because VLDL is not so easy to measure in the bloodstream. If you see it on your blood report or laboratory report, it is considered high if it is greater than 30 milligrams per DL. 30, that's 30 milligrams per DL. Okay, now I know what you're thinking. So, how did you end up? You might say, okay, well, how did I end up with high cholesterol and what can I do aside from taking medication? The answer is simple, because the cause and effect are the same. The cause and the effect or the cure are the same. Think about this. Your blood cholesterol was excellent when you were born, assuming your mother was healthy when she got pregnant with you. But how did you end up with total cholesterol of 300, LDL of 170 or 180? That's because of our diet. A diet that is rich in saturated fat, trans fat, cholesterol, and excess sugar. Here you'll see the top 5 sources of cholesterol in the American diet. About 25% of the found in animals, not in plants. Now, our third in the rank is beef, 11%, cheese, which comes from milk, which comes from an animal, it's 4.2%, and pork, about 4%. What about our top 5 sources of saturated fat in the US? Burgers and sandwiches, about 19% of saturated fat in the American diet are sourced from burgers and sandwiches because they have meat and cheese or both. The second are our snacks and sweets, which are also generously laden with saturated fat and excess sugar, 18%. Protein foods, 15%. Since many people still consider animal products or meat as their prime or only source of protein, they're not only eating protein but also eating saturated fats. Dairy, milk products, 13%. And then condiments, gravies, spreads, and salad dressings, 7%. These are our saturated fat sources in the American diet. But as you can see, or if you have noticed, this is not just in America, but also in other countries that have started adapting the westernized lifestyle. This table is a study comparing the bad cholesterol, the LDL, the bad cholesterol, between omnivores, lacto-vegetarians, and vegans. Who are these people? Well, it's easy to remember. Omnivores are those that eat both plants and animals. So basically, the little bit of everything kind of principle. Those are omnivores, which most of us start off as omnivores. And then the vegetarians, we have 2 kinds of vegetarians here, lacto-ovo. When you say lacto, milk, ovo, egg. So these are vegetarians that don't eat meat but still consume milk and egg. Okay? The lacto-vegetarians don't consume any meat but still drinks milk. And then the vegans don't eat meat and none of those anything coming from the animals, such as milk, dairy, and egg. None of those. If you look at their average LDL or bad cholesterol, you can spot the difference. The vegans have an average of 70 milligrams per DL of bad cholesterol. Give and take 29 or 30 plus minuses, right? If you plus that, it's still below or about 100 milligrams per DL of LDL, which is, which meets the normal lab value that is, standardized, set as normal in the lab report. And as you add more, as you add milk and egg and meat, the LDL, the bad cholesterol, goes up too. Now, people with high LDL are generally recommended to take statin medications: simvastatin, rosuvastatin, pravastatin, atorvastatin, anything that ends with statin. Those are for cholesterol lowering. Those are cholesterol lowering drugs. But the much more effective intervention, as you can see, is to target where your sources are of the saturated fat, cholesterol, and excess sugar. So by avoiding or significantly limiting dietary fats and cholesterol and excess sugar can dramatically decrease your bad cholesterol, those sticky molecules of cholesterol that will eventually plug your arteries and cause heart attack and stroke. So, in summary, when you look at your test results, you may see this as the numbers to hit in your lab report. But if you want to be more proactive and say, I want to significantly decrease my risk for heart attack and stroke, what can I do? The numbers that you are going to shoot for are these numbers on the right side or most right side column. So for total cholesterol, target a level of less than 140. For the LDL or lethal bad cholesterol, less than 70. HDL, more than 140, because that's the good, that's a happy cholesterol, cholesterol, happy. And then the triglycerides, less than 150. There you go, folks. I hope that you have learned a valuable lesson today. Please know that any information from this video is purely educational and not intended to replace conventional medicine. It's for me to support you in making health-promoting lifestyle and dietary habits. This is not a medical advice. I always want to emphasize that it is recommended for you to work with a physician who knows your medical problems and unique challenges, so you'll be guided on the proper steps. My goal here is to take you from being a bystander and feeling stuck and just relying on medications when you actually want to do more for your health. And this is why I'm doing this, to make you feel informed, not just feel, but actually be informed, proactive, and self-accountable with your health. All my videos are recorded and available on my website and YouTube channel, The Lifestyle Changer MD. Feel free to share my videos and replay as often as you want to, but I hope you'll make it a Sunday routine to join me live here on my Facebook group, The Lifestyle Changer MD, for your weekly dose of motivation and tidbits of health wisdom that can help you make better dietary and lifestyle choices. I'm here live every Sunday at 7 a.m. Pacific Time, or that's 10 a.m. Eastern Time. And to my kababayans in the Philippines, that's Sunday at 11 p.m. Bye for now, and I'll see you next week.